Hello class, we've come to the point where we're going to discuss the special patient populations. And of course that means our geriatric population and our pediatric population. As you know, in the laboratory, most of our reference ranges are geared towards those of us who are in the 18 to 50 age bracket, and we have to make different ranges for those who are below 18 and those who are above 50. So we have special categories created for those populations of patients, and we will go through them in this presentation. The first group that we're going to talk about are the geriatric patients. One of the things we have to be mindful of with geriatrics is the current demographics of the geriatric population. In the United States, we get this information from the United States Census Bureau, and the data that we have is from the U.S. Census Bureau printout regarding the year 2010 through 2050. So the U.S. is expected to experience growth in the older population. That's because our baby boomers have gotten older, and with our advancements in healthcare and preventive care, we see people living longer. So now they're living towards the 78 range of age, whereas before they were dying in their 50s and 60s at one point. So dealing with that as our premise, we have to now change how we look at laboratory medicine. In 2050, the number of Americans aged 65 and older is projected to be 88.5 million. That's quite a few people, and that's supposed to be more than double what was projected in 2010. Now we are in 2018, and we know that that number is on the rise steadily. For those of us living in Florida, we see it every day. Remember, driving on the highway. So what does this mean for a laboratorian? Well, it means that we have a situation whereby chronic disease increase. Anytime you have chronic disease increase, you will see a change in our ranges. What becomes normal now or more acceptable for that age bracket. Some tests related to kidney function might be the norm for them, whereas it is not the norm for younger individuals, and we will discuss that as we get further into this presentation. More laboratory tests are being ordered. What we see in Florida is these individuals come from up north and they come with good insurance. So they go to the doctor on a regular basis, and therefore we have to order more labs to see what's going on with those individuals. If they have certain disorders, those labs can be ordered as frequently as once a week, sometimes twice a week. At least every 3 months, we're seeing laboratory tests being ordered on the elderly population here in Florida. Next thing we have to do is adjust our reference ranges. Most of the time in labs, and I was a lab director, I can tell you that we have separated ranges. So we have a range that is acceptable for our pediatric population, a range that is acceptable for our children, a range that is acceptable for up to the adolescent stage, and a range that is acceptable for what we consider the normal adult population, at least to about the age of 50, 55. And then we have a range established for our geriatric population, those greater than 55, pretty much greater than 65. So you'll see that that change is going to continue to take place as people live longer. So why do we see changes in the geriatric population? What changes, what causes them to be in a different state than what we are? Well, as we've discussed in most of our other classes, that's just a natural part of aging. There's a little thing called homeostasis. Homeostasis is when normal aging decreases the body's ability to withstand stress and challenges as homeostatic mechanisms decline over time. So your coagulation, remember I've talked about that in our hematology class, for those who've been through the hematology class, the fact that there's a balance that exists between bleeding and clotting. That system is thrown off as we age, just by the normal wear and tear of the body. The other thing that we have to consider is there's a physiological reserve. Our body is such a unique tool or instrument that it does have some built-in reserves because it knows we are going to age at a certain point. So it has a little bit of extra in it to where although you're getting older, that organ is able to continue with the physical activity level that you need for functioning. Although it's decreased, it's sometimes decreased because you're older or because of disease state, but it still exists just at a weaker level. So in the geriatric population, which systems are we seeing being impacted by aging? Well, the kidneys, the bone, muscle, sarcopenia, endocrine system, immune system, gastrointestinal system. Those systems just have a normal wear and tear that occurs with them. Of course, we know other systems can be impacted with aging, but it's not just about aging, it's about lifestyle. And we have discussed some of those in previous sections, and the liver, the heart, and things of that nature.